Good morning children, welcome back to the second lecture of video of Civics chapter 2, role of government in health. Public healthcare system. The distribution of healthcare system, when we talk about healthcare system, there are two parallel in the society, public healthcare, private healthcare. If we talk about public healthcare is that healthcare that is provided by the government. So basic thing what it would be available even to smallest or remote part of India. Even rural area we have public healthcare system. There would be a doctor who would give you basic recommendation. Public healthcare system which would extend to each and every nook and corner of the country, starting from rural area to urban area. In a district we have a district hospital and so on. Public healthcare system is much affordable because it is cheaper, low cost, brings more people. However, nowadays there are issues about quality service provided under the public healthcare system. Government is keeping an eye on the service provided under the public healthcare system. We have National Health Assurance Mission, free drug and diagnostic and insurance coverage even for the service ailments. Under the mission Indradhanush, a government talk about providing universal vaccination and immunization program provision to all. There are things which brought in to revamp the public healthcare system. However, due to the affordability, approachability of a government hospitals, there is a high rush in OPD, outpatient department. Outpatient department is a department where the patient is primarily seen, that is the OPD. Then you have availability in rural and urban areas. And how does this public healthcare system runs? As you this know, this public healthcare is run by the government and bring in the amount from the taxes that are being collected. So money that comes in through taxes is one of the major source running of the government hospitals. Some of the basic ideas we will focus under the healthcare system. That idea is safeguarding the right to life, preventing the spread of diseases such as TB, malaria, jaundice, cholera. UNICEF says more than 2 million children die every year in India due to the preventable infection. So these are some of the things most we look around. Now moving on to private healthcare system. Private healthcare system which do not run by the government. Private healthcare systems are those which are run by private clinic or personal doctors. They exist in rural areas as well as urban areas. But when it comes to multi-speciality hospital, it is only in the urban centers because rural area doesn't find that much paying capacity to sustain a multi-speciality hospital. Under rural areas, we have RMPs, that is registered medical practitioners. In urban areas, we have specialized services such as diagnostic services in the form of CT scan, MRI, and physiotherapy, so on. With this, we have pharmaceutical shops which are involved with private healthcare centers. This private healthcare centers not controlled by the government, they have their own fund and profit they are raising. Because of this, they run the hospital or the private clinic. So what happens under private healthcare system? There is a more burden on the patient and more financial responsibility for the patient. So patient ultimately tends to pay more. Healthcare and equality. Now, as we seen over the year, private healthcare has been increasing more, so there is a more kind of specialized services available in urban areas compared to rural areas. So there has been increasing disparities between urban and rural in terms of healthcare facilities. The cost of private care increasing because private healthcare charge more. As a result, there are expensive medicine, expensive treatment also. Again, some of the private practitioners have incorrect practices, so they bring in more patient, they subscribe unnecessary medicines. So all those are incorrect practices that are prevalent in healthcare system. The statistics shows those who can afford medicine is only 20% actually afford medicine. Remaining 80% goes without medicine. So therefore, role of public healthcare system is prerequisite in India. Again, 40% patient who have admitted in hospitals have to borrow money or take loan in order to get the treatment, and also in some cases whole and soul bread earner of the family is ill, and ultimately and family goes into distress, more anxiety for the poor people. What can be done? Resolving issues. What are the issues need to resolve? First, of government should take care the responsibility by providing good health facilities, equal health care facilities to disadvantaged group and the poor group. These health facilities depend basic amenities and social condition. On the major example was from Kerala in 1996. Kerala government said let the 40% budget goes to panchayat, and panchayat are independent to manage their budget, so this panchayat spend the amount in the various projects like water, food, women development and education, Anganwadi, healthcare. So ultimately scenario in the rural developed with much faster pace because each of the panchayat was focusing the individual area they got to do region which have insufficient beds, doctors. So that's why root problem has resolved. Similarly to this Costa Rica in South America, this country says they do not spend a penny on defense services, so all the defense money should be diverted to the healthcare facilities. As a result, they have ample of funds that goes to healthcare facilities, save water, sanitation, nutrition, and basic amenities. Standard of living improves as a result in the nation. So Costa Rica is definitely a unique example for India. Can take out points of its not exactly if want to replicate the model that won't be practically possible, but can take more ideas in order to provide more focus on basic amenities and the healthcare system in India. Constitution says duty of the state to raise the level of nutrition and standard of living and to improve public health should be implemented in reality, and implement should strengthen much further. So that was the basic idea, providing you about framework about what is public healthcare system and private healthcare system and how here healthcare system runs in India. So children, this is the end of the chapter. Hope all of you understand the chapter well. Inshallah, we'll meet in next video with the new topic of history chapter. Till then, goodbye.